Sorry, can you hear us, Carletta?
Well, I can hear you now. I wasn't hearing anything before.
Oh, you. Okay, 1 second. So technology is troubling us. 1 second today.
It's okay.
Okay. Okay,
Not
I
hearing
think
anything.
there is a message. Yeah, I will give you a brief introduction of yours.
Pardon?
Okay, before you start your session. I will give you a brief introduction because there is a technical glitch in the video.
Okay.
So yes, Alita Eversley Gabriel is a transformational nurse leader with over 30 years of experience in the healthcare field who started as a CNA and is following her passion to becoming a CNO. Carlotta considers herself to be an agent of change and is intentional about everything she does. Currently, she is a personal consultant and co owner of Elite Nursing Services and continues to appear at speaking engagements and conduct seminars on self empowerment, intentionality, and excellence at every opportunity she gets. Too, she will always say that her greatest accomplishments in her life are her family and the successes of our children. Mrs. Carlotta is an astute leader who has held numerous roles as an advanced clinical nurse educator, assistant director of nursing, nurse administrator, and nurse professor at one of Georgia's top nursing schools. Her experience and expertise transcend multiple specialties in various organizations that includes but is not limited to trauma hospitals, one of the largest female correctional facilities, long-term rehab, and behavioral health with a focus on leadership in women's health. Mrs. Eversley has a membership in numerous organizations, including Sigma Theta Nursing Honor Society, and has been recognized by Marquis, who top nurses for 2021 Marquis, who in America 2020 to 2021. Currently, Coletta is currently pursuing her doctoral degree in nursing. It's really a wonderful presentation. Wonderful biography. Thank you so much, Carletta. So you can use the stage now.
Thank you. Thank you for it all. Thank you for having me. I am very much honored to be part of these astute leaders and entrepreneurs, to discuss women issues. We are definitely in a crisis when it comes to women's health, and one of the things that I wanted to point out or to bring awareness about is about what's going on in pregnant moms and our black and brown moms that are dying at an alarming rate after giving birth. So I first want to show a little video if that's okay. And that is basically just to speak a little bit about what my conversation is going to be about. This video is something that happened here a few years ago, where a mom, healthy mom, went into one of the best hospitals to deliver her second baby, and she never made it out. And even though we are having the conversations and we are trying to improve on our care, there is still so far that where we are and where we need to go. So one of my reasons for this platform is to be able to spread awareness as an educator, as a nurse leader, and as a woman's health educator. So this is very dear and close to me. So I'm going to share my screen. I hope that everyone can see it. Um, okay. Can everyone see my screen? I can't even. One second. Let me see. I'm trying to share my screen here. Is there a. This is my first time using this air meet. Is there a. There isn't. I'm trying to share my screen. Can someone help me with that, please?
Yes, Carlotta. So beside audio button, you can see the upside arrow, right? Upward direction arrow.
Okay.
Okay, just click on that.
Okay, I see it. Thank you.
So you can share screen, right? Oh, yeah. Just share your screen. I will let you know whether we can able to see or.
Okay. I'm trying to get to my. I apologize. I have so much hair.
That's okay. We can understand.
Uh, Let me
Did
see.
you see? Did you see?
Okay. So it just seems as though I am having. Um,
So did you see the upward direction arrow button
I
beside
did see
audio?
the arrow button, but I'm
Okay.
trying to get into it. I did see, but it's not allowing me to share my screen. So one second. Let me just be able to share. One second. Alrighty. Let me see if I can pull this up now. Still cannot see this. So it's not allowing me to, even though this is,
Not allowing you.
I don't know why this is, so I
So
clicked on,
no, when you click on the upside arrow button, share screen, so you can see the share screen button or the select PDF file. Just click on the share screen button. So once you
I did,
click on the share screen button, you can see, yeah, you can see the three tabs, right? Chrome tab, window, and the entire screen. Okay.
okay, yes, but I am trying to
So just
get to pull up my download.
Mhm. So where is the presentation is placed in your desktop?
Yes, on my desktop, and it's just sitting right in my, yes, my download is right on my
Yeah, it's in
desktop.
your desktop, right? Yeah, just click on the window button, okay,
Okay,
and select the desktop. Okay, select the desktop
okay,
and click on share.
okay, let me see. I am sorry, this is not, this is, I'm getting a problem here. So what I will do,
What is
I
the
will go ahead and see. Um, one second. Let me try this again, and if not, I will just go ahead. I tried this out and it worked perfect. So now anyway. Okay, so I go. It's not allowing me. See, it said share, but it's not allowing. Okay. Alrighty. So I am not. I am really having some difficulties here. I apologize. So I will quickly. I wouldn't be able to share it. So, but I'll speak a little bit um, about what my topic is about, and I will just talk a little bit about that. I apologize for the inconvenience. This is, to say the least. So I started off by saying that, you know, um, we have to save our women. And we have to save our women because a lot of our women are dying in alarming rates, and they're dying for, avoidable things are happening that is causing them to die. So when I talked about postpartum hemorrhage, I talked about the fact that there is a um, over 700,000 women that are actually in that are plagued with postpartum hemorrhage. And what postpartum hemorrhage is, it's the bleeding that occurs in a woman after she gives birth. So we have the primary postpartum hemorrhage and the secondary. The primary happens within the first 24 hours, and the secondary can happen up to 30 days. And we are seeing that even though we have improvement in medical treatment, in care, lots of hospitals has worked on developing lots of training for the nurses so that they can identify a woman who is at risk for postpartum hemorrhage. And even though we are doing all of that, there is definitely it's still plaguing our society. Actually, I was reading the WHO. They're saying that America actually has one of the highest rate of postpartum mortality. That's what it's called. Young women dying in childbirth or right after giving birth. And this hit home to me because I'm a mother of three, and even though my kids are here, I actually did have postpartum hemorrhage. And when I see how many women are dying for something that is preventable, that in itself to me is an atrocity to us human beings. It doesn't matter the color of your skin, your socioeconomic status. It doesn't matter any of that. So there's some staggering stats. It says over 14 million women experience PPH, resulting in 70,000 maternal deaths globally. So this is global, and it's not it's not happening in one country or in one continent or one hospital. It is global. So we have an issue here. Um, I'm sorry I couldn't show the video, but it was this young woman, like I said, she lost her life. And one of the things that her husband has decided to do is that he wanted to make sure to honor his wife. He goes out and he speaks at different conferences, March of Dimes, different hospitals, and he partner up with lots of organization, A.W.I.N, which is an American Association of Women's Health. He partner up with A.W.I.N, and he is getting the word out. He actually worked on passing a bill, one BSR5, to help hospitals be aware of when a woman comes in healthy, there is no way she should not be leaving So that in itself was something. I met with him because, like I said, I am a champion and I'm a proponent for women's health. And because I had that experience myself, I always wanted to educate, to raise awareness. So I go to hospitals and I work with a lot of the hospitals, including one of our leading hospitals here, just to discuss how we can mitigate this global crisis where women are concerned. So right now there is a PPH, which is postpartum hemorrhage summit, that is happening in Dubai. And the objective for that summit is so that they can really and truly find the answers. How can we mitigate this? What are the reasons why we have women that are dying in such alarming rates? We have to find another way. Obviously, what we are doing isn't working. So we have to find another way. So they looked at all of the researches. They are looking to see how they can have guidelines, and there's lots of advocacy group. The Joint Commission, even they rolled out a 2022 it's an initiative to just to speak to postpartum mortality and morbidity, and I'm sure a lot of people may have heard about it. And even if you're not in the childbearing age, I'm sure you know a young woman, a mother, a sister, a friend of a friend. But this is something that we definitely want to make sure to continue to have the conversations and continue to spread and raise awareness. Even to Bill and Melinda Gates, they have a foundation that caters to this, to the PPH and mother dying in child's birth. So, as we were doing the investigation as to why women are dying in such alarming rates, it's a lot to be said. The people are saying that it's racism. Black women aren't getting cared for, but white women are dying too. So they're saying that you have to be of a social economic status. That's not the case, because the woman that died, she and her husband, they're very affluent people. So it has no color, it has no gender, it has no age, and it definitely doesn't have a socioeconomic status. And I don't want to attach race to it because I feel like it's beyond confines of race. Um, so when we talk about postpartum hemorrhage and a woman just giving birth, there are certain things that needs to happen during and right after, especially if she is at high risk for that, because there's a few things that I know for sure that can cause postpartum hemorrhage, and that is, that we call it the four T's. The four T's is the tone, trauma, tissue, and thrombin. Basically, the tone is how you care for yourself and your muscle, because the more relaxed the muscle, the more you can bleed. Trauma for moms who have had C-sections, who've had multiple births, they are at risk also, because they have had a lot of work done in the uterus, where they are, it's easy for the uterus to bleed or not contract the way it's supposed to. And tissue, some women who may have a retention of placenta, retention of something. And then there's the last not least, thrombin. Those are some women, those rare cases where there are people that have issues with clotting factors and so forth. So those are some of the reasons that we know that causes or help to cause postpartum hemorrhage. We can work on controlling the four T's. What about the things that we cannot control? What about the attitude of the nurses who are taking care of these moms? What about the patient who is not aware and cannot advocate for themselves? So those are some of the things that I want to speak up and out about, because I feel as though we have to be able to have the conversations. And as we talk about the toning of the uterus, that's one of the things that if the uterus is weak and if it's tired, again, if you have lots of kids, a lot of times that will be something that you have to watch out for, or having taking lots of medications, or patients who are not who don't go to the bathroom, so their bladder is having they're having problems emptying the bladder, so the bladder contracts and hit with the uterus. So all of these things definitely causes bleeding. The trauma, of course, I mentioned C-section, and I mentioned, some of the instruments that are used for C-section. Some of those things can also cause lots of trauma. And then thrombin, like I said, it's one of those things where if you have a clotting factor, that's why it's important when you are pregnant and when we're bringing another life into this world. We want to have the conversation with our doctors and be transparent and honest and let them know that, you know what, this is what is going on. This is my medical condition, because they will know how to treat you. That's anticipatory guidance, where they're knowing how to treat you based on the information that you give to them. And this is really alarming, because as I'm looking here, and this is why I will try my best to send out the PowerPoint, and if we can hand it out, I would love that to happen, because I have so much stats here, and sometimes just seeing this and having a visual, it really helps you to understand this crisis. They said deaths per 100,000 deliveries. They said 121.8 Black women die a childbirth or postpartum, because of a postpartum complication. And then we have brown women, we have them up to 40-50%. So this is really an issue. And as I did a lot of my studies, one of the things we looked at is some of the comorbidities that is in our Black and brown women in the society, where they have hypertension, diabetes, kidney disease. There are lots of comorbidities going along. So there is a, they're saying that the higher your comorbidities, the more you're at risk for postpartum hemorrhage. But what about a young woman who didn't have any comorbidities? She went to one of the best hospital in the US. She and her husband, like I said, young, healthy, vibrant, affluent, intelligent people. And it was because of the negligence of the staff, which that is another issue. That is why that has contributed to her bleeding 3 mLs of blood into her abdomen. And even after she was telling her husband that she wasn't feeling well, and this was all in the video I wanted to share. The husband went and he raised an alarm. He told the nurses, he told the doctors, and they said, okay, we're gonna go and do a sonogram just to see. And it took them 6 hours to do a sonogram. And of course, by the time they decided to do that, she already had 3 liters of blood in her abdomen. So that is negligence. That is cruel. So those are the things for me that I am going to champion to work with any organization that will allow me the opportunity to come and have conversation with the nurses, have conversation with the medical staff, because these are the kind of biases that we have to work hard to mitigate, because it's causing lives, and that's the problem for me. When we talk more about these things, lots of times as we talk about it, we raise awareness. Awareness helps us to implement change, but we have to do something different. One of the things that I was instrumental in Atlanta, Georgia, I'm at one of the hospitals. I worked at one of the top um, foot hospitals in Georgia, and we worked on putting together, it's called a treatment plan for PPH. It's just putting together something we can do in house. So we worked on discussing how we can get to the point where we reduce our postpartum hemorrhage mortality, reduce it to a point where we're sustainable. So we worked on some things, and a team of us came up with some great ideas for our postpartum. We call it a postpartum hemorrhage bundle. And basically what that does is that we identify, and that's another thing too, as part of my presentation, we identify how we can, if somebody comes in and they're at high risk for postpartum hemorrhage, what are some of the things we can do? We can, of course, make sure that the nurses get a full history of from them. And in educating the nurses as to these are the things that you guys have to do. We want to make sure that they are going to be close to they're going to be close to the nursing station. So if anything happens, they're easy accessible. We want to make sure that all of the drugs that are used for to help with contracting the uterus, we want to make sure it's ready, it's at hand, it's there, it's accessible. And also making sure that we have blood products. We don't want to wait until something is happening then to call the lab, say we need some blood products. We want to make sure that we have that at hand. When I said at hand, easy accessible. And those were some of the things that we were instrumental in working and putting together. And we also had a visual awareness and a visual cue where we put our patients into categories. They were high risk, medium risk, and low risk. And then we did have some hearts, a red heart, a yellow heart, and a green heart. And it is so beautiful because what it speaks to, the heart, we care about you, but also it is letting us know the red heart denotes that this patient is high risk for postpartum hemorrhage. So we have got to put the cart close by, make sure that everything is there for that patient. And then the one who is medium risk, then we know, okay, that's a different level of assessment. And then, of course, the ones who aren't at risk. And doing that, that helped us to our postpartum hemorrhage rate dropped from well over 70-80% to less than 5% within a 3 to 6 months. So it was very effective what we did. And that is doing the things that we can do. I believe that as a nursing leader, there are things that the organization can do. And then there's things that we as individual leaders and nurses, there are things that we can do. So I always empower that. How can we make this situation different? We're not going to wait on the hospital. We're not going to wait on Joint Commission. We're going to wait on those places, yes. But what can we do with what we have? So we were that was very effective. And because of the effect of that, I actually did with some of my colleagues, we presented at one of the biggest women's conference here in the United States. So we did present it at the A1 conference, and they used our strategy, and they were able to use it to help other hospitals, for them to use this as one of their first line defense, things that they can do right away. How can we prevent this from happening? Why are such healthy women dying in alarming rates? There is something that we can do about this. Let's work together in doing that. So my team and I, we did go to hospitals. We visited a few local small hospitals here in Georgia, and we were able to let them see what is it we were doing, and they were able to emulate that, and we helped with that process. However, it is still a big deal right now. It is still something that needs more attention, needs more awareness. And when I looked at some of the staggering stats still as I was doing some more research. I like to do research. And I see that in spite of everything that is being done, this is still an issue. Lives are still being lost. This is not, like I said, it's not per country, per hospital, per color of skin, poor. It's none of that. It transcends beyond that. It transcends globally. And I said every platform that I get, I would love the opportunity to be able to spread awareness, to be able to have conversations with people. One of the things for me, I feel as empowering and advocating for patients, patients should know the questions to ask. If you're going to a hospital and you are, pregnant, and you are and ready to deliver, you may not understand all the questions that goes with that. It's the experts that know the questioning. However, I do believe it's important that you ask the question. You ask the question of, okay, what is in plan for me if I started to bleed? Can I have someone here with me who can advocate for me if I cannot for myself? Can I have my husband, my mom, my sibling, whomever? Because we need to have people there advocating for us. Even though the young woman that died, her husband was there and he saw that she wasn't feeling well. She said, I'm not feeling well. And he noticed that there was some blood in her Foley catheter, which is where they draw the urine. And he called the nurses and he called out and no one came. So then we have those kinds. So there's levels to this. But what I want to impart is patience. Ask the question. Whomever you're gonna have as your person with you, let them ask the question. If somebody is giving is feeling offended because you're asking questions, well, that's a different conversation. You should be able to ask questions. Ask the questions, know your numbers, know when you are bleeding too much and when you're not, because that is how lives are saved. When we speak up, when we advocate for ourselves, and when we are able to let people know that we are aware of what the expectations are. So, I want to really and truly hone into this a little more. My slide here, it says, we have to prevent 1,000 maternal death, to prevent 100,000 cases of severe maternal mortality. Is just sometimes to ask the question, be vigilant, make sure that you are, if you're not feeling well and you have someone with you and they're there with you, you let them know that you're not feeling well, and they, whomever they are, has to go, and they will go and let the nurses know, let the doctors know, raise an alarm. However, whichever way, I will always say that, because those are the things that we as medical professional nurses, we cannot control what is said to us. What we can control is, okay, making sure we have the blood, making sure we have the IV, making sure we have the things that we can, the interventions to put in place as soon as we see something or someone is having a difficult time. And I want to wrap this up because even though I didn't get to present it the way I wanted to, I am a strong believer that I am going to get my message out. It doesn't matter technology or not. I'm not going to allow that to preclude me from speaking my truth and to getting the message out for us to all be aware. This message may not be for all of us, but it will be for somebody we may know in passing, a friend or kids, and because I am not only I had postpartum hemorrhage and I would not have been here if it wasn't for my husband, who was really and truly, because he's in the medical field, he was able to advocate for me also. So I am here to see my three children go to college and grow up. But what about the mom, Kiera, who didn't, who, the husband is raising his two sons without a mom? What about the other young nurse practitioner, a friend of mine, whom went into the hospital and never came home? Her mom is there advocating, and she is spreading awareness. So I am speaking for the people that cannot, that doesn't have the platform to be able to speak to and speak up and speak out against, because I feel as though um, I am here for a reason, and because I can use my story to help empower and inspire someone else. That is my goal, to be able to spread awareness and make sure that people understand that this is not this is really a crisis. And lots of people may not have heard of it because they're not in childbearing age or they don't know anyone that is, but there's lots of people who are, or who know someone, or who have lost someone. So those are the people that I am very I want to make sure to speak up and speak out against and for. And as I wrap up here, my last slide, it show a picture of my family. And I said, we can all do better and we will do better. We just have to work together. And a lot of times it takes one person to make a change. And I feel as though I have made significant strides in my goal, in what I want to do, in abating this terrible crisis that is affecting our women. Thank you. Thank you so much for the opportunity. Thank you for allowing me to be here in spite of my, my technological delays. I appreciate it, and I thank you guys so much. If there's any questions or concerns, comments, I would love to answer them.
Yes, thanks, Carlotta, for the amazing speech. So, in today's feel like after pregnancy, so there will be a lot of changes in the women bodies, right? So, a lot of
Yes,
changes physically, mentally. So,
emotion.
yeah, yes. So we don't know. Sometimes we do not know what we are actually. Even though it is a very minor thing, but we will react much. So
Yes,
we do not know what was happening.
yes,
So what we can do, what actually these symptoms, so how to overcome this. I know some people feel so shy to share with the
yes,
doctor.
yes,
Yes, so it should not happen. Actually, we have to share everything because doctors and nurses are like gods for
yes.
us because they, yes, definitely. So, so what are the precautions? So how to overcome that shy? So can you please let us know so that it will be helpful?
Sure, sure. So one of the things I believe that, as though, especially, being pregnant, like you said, there's lots of changes. We have lots of changes. The body goes through a lot. And sometimes it is hard for us to share and be honest. But just think about the fact, if you are not being honest, then how can I help you to be successful? So in knowing that, if you tell your doctor, you know what, this is my fourth kid, my last child, I bled a lot. The doctor needs to know that, because you are at risk for postpartum hemorrhage. Postpartum hemorrhage leads to death. Now, it's not in the past where one can have heavy bleeding and they bleed for a few days and then they're okay. No, postpartum hemorrhage is synonymous with death. And lots of women are losing their lives simply because it's either they haven't spoke up to let the physician, the doctor, the nurses know, this is what is going on with me. I am, I've had two abortions. That's another thing too that can help with the postpartum hemorrhage. Because what it does, it weakens our uterus, and anything that weakens that can can be a cause for us to have postpartum hemorrhage. So, being as honest as possible and as transparent as possible with your doctor will help your doctor and your nurses to help you. So being honest, and it's hard, but if you can have that conversation, with them by themselves, even if you have to write a note, something, you just let them know, because when they know that, then they can do what is necessary to prevent you from falling to being another one of those young women that are dying. And I look at this as low hanging fruit. In my vocab, low hanging fruits are fruits that you can pick easily, which means that we have what we have and we can help make a difference. But if we don't know what is going on, then how can we? So I encourage everyone, I encourage anyone, be as transparent and as honest as possible. And um be able to know your body if you're pregnant. And if it's your first child, I can understand you will have lots of questions. Reach out to your doctor, ask them for information. Says, I heard about postpartum hemorrhage. Tell me a little more about that. Do you guys have some education pamphlets that I can take and I can read so I can prepare myself for this just in case it happens? Because we never know. That young mom, Kiera, when she went to that hospital, um, she was excited. She had a 3-year old and she was pregnant with her second child. And she never left there. And I worked with her husband and we championed to get the message out. And they were proactive. They mentioned, they were transparent. They were able um, to advocate for themselves. But even in advocating for yourself, sometimes things still happen. So to the person who advocates, but then there are barriers in the hospitals that precludes them from doing their job, then that is where we're on this national thing, a joint commission to ensure that there are things in place now. We have these initiatives that there are things that each hospital has to do yearly to ensure that they're following the protocol that is necessary for a woman who is at risk for postpartum hemorrhage. So the patient doing what they need to do by being transparent, knowing their body, calling out if they need help. Just call the doctor, call whomever. I am that first nurse. If my patient calls me 20 times, I'll go 20 times because I know that something is wrong, and until they are alleviated in their mind that they are okay, then they're gonna call me, and I'm okay with that. Um, but the parts for the hospital and the parts where they're saying it's racism and there's all these different things that are bundled together as to what may be the cause for this. But what I can say, it is a crisis. It's affecting our women. It is killing our women. Black women, brown women are 4 times more likely to die in child's birth, postpartum hemorrhage, than a white woman. So it is a big deal for us women. We have to, it's not a my problem, it's not a you problem, it's a woman's problem. And I feel as though today, doing where we are, happy International Women's Day, we have to talk about these. These are some of the conversations we need to have. So I am thankful for the opportunity.
It's really excellent. Thank you so much for the well answer for my question. And one
Yes.
more question. Uh,
Sure.
so, hmm, people with pregnancy, some people don't have any symptoms in the third trimester. So,
Yes.
babies, everything is fine, but there will be sudden abortion will happen without any reason, right? So nowadays,
Yes.
we can see lot of miscarriages. So,
Yes.
is this a lifestyle or the diet we are taking, or what is the main cause of this miscarriages? Even though if we are following the proper diet, exercises, and everything, but still there are a lot of miscarriages are happening nowadays. So, what is the main thing? What is the main thing we need to follow? So, even though multiple follow-ups with the doctors or nurses, everything is fine, but suddenly we will come up with miscarriage. So what is the
Yes.
proper yes.
And that's a very good question because I myself, my husband and I, we suffered a fetal demise. I was pregnant until 34 weeks, and I just woke up and there was no heartbeat. And when I went to the doctor, there was no answer for why that happened. No one could tell me. There was never an answer. Of course, as women, we are internalizing these things and we blame ourselves because I went through that, where I felt it was something I may have done. I may have ate something, and of course talking with doctors and understanding that no, this was out of this was out of your control because that was a fetal demise, and my our child was in the third trimester. So there are some times when there is nothing, no plausible explanation, things just happen. I
Yeah,
believe
this really,
I believe in a higher power, and that the timing wasn't for that. Um, but I do believe that when we are, if that is something that we want to do in having a child or having a family, then like everything else that we put effort and emphasis in, we need to make sure that we are wholesome mentally, physically, spiritually, and emotionally. We need to make sure that we are in a good place, because everything that we do and say, and how we live our lives, that there is a soul that is feeding from us. So we want to make sure that whatever we do, we are doing the right thing all the time. No drinking and smoking and all of those different things. So so there hasn't been a conclusive study as to why miscarriages happen, but there has been lots of studies that says that, these are some of the things, if you, watch what you eat, your diet, certain kind of exercise, even though that hasn't been proven. So there's lots of reasons why it can happen. So I am not, I don't want to ever say, get on a platform and say, well, this and this and this is why it happened, because I don't have any proof of that. Even though I'm a researcher, I haven't found that researchers yet as to what causes it. So yeah.
yeah, that's okay. So thank you so much, Kalata. I know I am asking more questions, but
It's
you are giving
okay.
you the yeah. This is the yeah. This is a common problem for every woman, right? We are emotionally, physically very strong because we will take care of we are taking care of our house, and we are giving the birth. It's not an easy job for a woman.
It's not.
So we are so proud to be a woman. So I'm so proud that we as a WIN conferences organizing all the wonderful women
Oh,
all from all
yes.
over the world at one spot, sharing their wonderful experiences. And so yeah, every presentation has giving us some message. Every
Yes.
presentation letting us know uh, something new. So thank you so much, Carlota, for
Oh,
being on
you're
this
welcome.
stage. Yeah,
Yeah.
have a wonderful day. Thank you.
Yes.
Bye
I
bye.
wanna I wanna thank you guys also. I must say, actually, that was supposed to be when I started speaking. I must say, this is my first time coming here, and I didn't have any, of course, didn't I figure I'll come and I'll speak to what I'm passionate about. And but one of the things I must say I really admire you guys is not just the professionalism, the way, if I send a message, I get a response, a speedy response. I really and truly enjoy this. And trust me, I have already been speaking with other professors and other nursing leaders, because I do believe that there is a place for us as medical professionals to come out and speak on things. There is so many things that is going on, and I believe the only way we can make things better is by having the hard discussions. So I am, I will definitely continue to spread the word, share my story, share stories, so that we can help better women and propel women to go forward. And what you guys are doing is awesome. So thank you for this opportunity. I am
Thank
honored.
you. Thank you. Thank you so much, Carla. Thank you so much for supporting us. So we need your continuous support so that we can organize our future events as well. Thank you and have
Certainly,
a
I enjoy.
have
The
you
same.
wonderful.
Thank you. Blessings to all. Thank you. Have a great day.